Thanks, Marvin. So there are two types of... Have my first slide, please. There are two types of thinking, straight and crooked. The book illustrated to the left is a classic in the art of confused logic, using confused logic to contradict reality. And that's the case with our current health system. I apologize to Chief Kim Baird for the picture to the right, but that is me as a 3-year-old outside my house in post-war Liverpool. In the movies of that era, the Indians never won. But I played the Indian when every other kid wanted to be the cowboy. And as you can see, I challenged and beat the cowboy. This attitude may explain why I ventured into promoting change and transformation in a Canadian health scheme that often fails to fulfill its promise. Nigel Lawson, an English politician, described the National Health Service as the closest thing the English have to a religion. That applies even more so in Canada, where many have strong beliefs, and I often call them prejudices, about Medicare. It's always difficult to challenge a passionately held belief or dogma, but I've therefore made my theme 7 deadly sins that are responsible for the crooked thoughts on Medicare. The first and worst of the sins is the failure to understand what we have. The World Health Organization ranked us 30th best health system in the world. It's still better than the United States, which ranked 37th. The European Consumer Health Powerhouse, in a survey of 34 countries with universal care, has, for the 3rd year in a row, placed Canada near the top of the pack in spending and near the bottom for results. We were dead last in value for money. Other studies comparing us to 6 or 7 developed countries rank us last in IT use, worst in waits in the emergency room or for a doctor appointment, and last in access to advanced technologies. Despite receiving the greatest support by donations of any hospital, 65% of patients at BC Children's Hospital wait a medically unacceptable period. We can and must do better. Canadians are nice but passive. We accept laws of a type that do not exist elsewhere in the free world. Laws that make it illegal to spend one's own resources on the health of oneself or a loved one, even when that person is suffering in pain on a wait list. Thankfully, in 2005, the highest court in the land decided that Quebecers suffering delayed treatment had a constitutional right to extricate themselves from their pain and suffering. In BC, we are currently engaged in litigation that will ask the BC courts to rule on a very, very simple question. Should a BC resident suffering on a wait list have the same protection under our Constitution that the Supreme Court of Canada has granted to Quebec citizens? In Ontario, a citizen who jumps the healthcare queue is subject to a $10,000 fine. That is the modern Canadian equivalent of hungry paupers in the English Middle Ages who were executed for stealing food. This draconian law was created to protect a failing system. The ancient Athenian lawmaker Draco would be proud. Supporters of the status quo in Canada are in a state of economic denial. In each decade since the 60s, health costs have risen by 1% of GDP, up until this decade, in which the rate has doubled. As health spending approaches 50% of provincial revenues, it is crowding out expenditures on other essential services. Advanced technology, modern but costly drugs, and a baby boomer bulge will threaten the sustainability of the health system. After producing half as many children as our parents, who will generate the tax dollars needed to fund our future health needs? Can we morally expect our children to support us as we retire, age, and further impact the health system? All Canadian governments claim that the rate of increased spending on healthcare is unsustainable. We need long-term planning, but sadly for us, governments operate on short 3 to 4 year financial cycles. During my term as CMA president, I met with multiple media outlets in every part of the country. The media must engage this issue and recognize that change will impact positively on the less privileged in society. Canada has a grossly inequitable health scheme in which the poor and underprivileged suffer the most. We do need the media to promote the truth about our performance. History won't be kind to Canadian politicians. Our children will look back at their collective lack of action and leadership in enacting healthcare reform. Many politicians are compromised by hypocrisy as they gain access through power and influence. They adopt the principle that what's good for the public is good for the public. Without naming names, I can tell you that our Canby Surgery Centre has looked after many NDP, Conservative and Liberal politicians and their families, as well as leaders from the unions that continue to mount and fund attacks on our very existence. At election time, healthcare has been the #1 issue in Canada and the United States. Obama recognized this, and it became the main focus of his campaign. Canadian politicians cannot keep ducking this issue. Support for the status quo is a sign of inertia and weakness. The vision of Tommy Douglas was that no Canadian, rich or poor, should suffer on account of being unable to afford necessary care. It was about creating a floor beneath which none shall fall, not a ceiling on what can be achieved. The World Health Organization has stated that if services are to be provided to all, then not all services can be provided. Our insatiable appetite for healthcare means Canadians must make choices. A byproduct of our system is what I call the medical KGB. Few Canadians know that their medical files are open to government surveillance. Citizens cannot block that access, and consent is not needed. They need not even be notified when their file is being accessed. It's time for a reality check. Rationing and delayed access cause suffering and deterioration. This adds tremendously to costs, as we literally pay to prevent patients from getting access. Irreversible damage and drug dependency are just two examples that result from delayed care. Other developed countries offer universal care without wait lists. They operate with competition, both public and private. They have government participation and regulation, but not a monopoly in the funding and delivery of care. That distinction is unique to Canada. In Canada, the poor and underprivileged receive the worst care. It's time for change. We must convert our health scheme into a health system. The solutions are complex, but let's start by embracing competition and learning from the best practices of countries that outperform us. Thank you.